My name is Dr. Ron Takimoto, and in this video we'll be discussing the pre-event preparation as well as the early management of spinal injured athletes. Football today is a fast contact sport, and modern day players will continue to sustain injuries to the spinal region, which can often be catastrophic and life-altering. Football players who sustain cervical spine injuries must be properly managed to prevent further neurologic damage. The management first starts with pre-event preparation. First, the athletes must be fitted and evaluated with the appropriate safe equipment, such as the shoulder pads and helmet, and to make sure that there are no broken components and that the helmet is not loose. Also, the coaching of appropriate playing techniques, such as no spear tackling, where the cervical spine is in a straight line, which can produce increased axial loading. And a rehearsal is required periodically with all the involved personnel. This emergency action plan designates who the appropriate healthcare practitioners are, the chain of command, and who is the team leader. Make sure to check with different state laws if traveling with your sports team, as laws in different states may vary. Communication and pre-arrangement with a hospital that has the capacity to handle trauma patients and spinal cord injury patients is critical. Also, to determine what are the transportation needs. Is there an ambulance involved, the EMTs, or paramedics? And finally, make sure to document fully all of the procedures that are performed. A special toolkit is needed to remove the face mask off of a helmet. A power screwdriver is used because there is less vibration and movement of the head. One should also have a manual screwdriver in case the power screwdriver is not working. If these are not successful, then one needs to have clippers or scissors to cut off the plastic attachments. A tongue depressor is needed to move the inner pads from the earpieces, and a special tool to remove a bolt if it's not a screw type. Right before game time, a pre-event timeout is needed to review the emergency action plan with all of the members present, since different personnel may come from week to week. Once at the event game site, in any suspected athlete with a spinal cord injury, one needs to follow the usual ATLS or BLS protocol. In the primary survey, one needs to assess the level of consciousness and the ABCs of airway, breathing, and circulation. One should also provide immediate basic life care support as needed. A decision about transportation to a hospital should also be made at this time. In a secondary survey, one should take the vital signs, do a quick head-to-toe evaluation, and a more thorough neurologic evaluation at this time. At this time, current recommendations from the American College of Sports Medicine advises against the immediate removal of a helmet from an unconscious patient or a spinal cord injured patient. The face mask should be removed, however, if access to the airway is needed. The modern football helmet has the face mask attached to the helmet with some screws and a plastic fastener. The fastener is usually by a screw-off mechanism or a bolt mechanism. One should try to take off a screw which needs a power drill first, and then if that fails, one could cut off the plastic fastener. When taking the bolts off of the helmet, one either uses the special bolt remover or the power screwdriver. In the event that the power screwdriver or manual screwdriver does not work, then special scissors or clippers can be used to cut the plastic fasteners. If it is necessary to remove the shoulder pads, then the laces are cut with a scissors and the helmet and shoulder pads are removed together. In review, a development of an emergency action plan is critical. A pre-timeout prior to the game is also important. And when using your equipment removal system, make sure to practice that also, as different materials are used in different places. The movement of the helmet and shoulder pads should only be performed if absolutely necessary.